Hi, I'm Justin Riley. Today on Wisconsin Doctors, believe it or not, high school football practice is now in full swing, and we are on location at Fort Healthcare to learn a little bit about concussion management. It's something that not just high school athletes need to worry about. If you have the potential for a work-related head injury at your place of work, you'll want to stay tuned for this show. I'm joined by a fabulous team of folks who help to deal with concussion management, including Lori Runty, advanced practice nurse practitioner and certified pediatric nurse practitioner. She's a primary care provider here at Fort Healthcare. Julia Neppel, sports medicine coordinator and impact-trained athletic trainer. She's also a physical therapist. Paul Incha, physical therapist at Fort Atkinson Therapy and Sports Center. And Brian Meitner, impact-trained athletic trainer. It's all coming up right here on Wisconsin Doctors. Stay right here. Welcome back to Wisconsin Doctors. We are at Fort Healthcare learning about concussion management today as we head back to school and the kids head back to football practice. It's an important topic that I think we all need to address, and I'm joined by a fantastic team of concussion managers. Can I call you guys concussion managers today?
Sure, that sounds
great. All right, so I'm going to start with Lori Runty. First, can you talk to viewers a little bit about what exactly is a concussion? When someone says concussion, what does that mean?
Sure. A concussion is a type of brain injury that interferes with normal functioning of the brain. It can be referred to as a mild traumatic brain injury or an MTBI. There's a movement now out there for us to use that term as providers because in general the public doesn't really see the seriousness as a whole of what a concussion is. And so we're really trying to make sure that people really do understand that this is really truly an injury of the brain. Some signs and symptoms of a concussion might include, and you don't have to have all of them, a headache, a feeling that you're in a fog or mentally foggy, nausea, sensitivity to light and noise we often see, and as well as concentration problems. Concussion typically affects people in 4 general areas of functioning. The first being the physical side, which I kind of mentioned. And then also there's the aspect of thinking or your concentration and memory. Another area is emotionality. And we oftentimes see that a little bit later on as the person is recovering. And then also sleep can be very much disturbed as well.
Absolutely, and it sounds like a lot of these things aren't symptoms that necessarily come immediately after impact. They're something that you might notice 24 hours, 48 hours later, so it's something to be mindful of.
Correct, yeah. Correct, very true.
So I've heard for a while now that concussions are rated or ranked. Is that still true?
Well, at this point in time, no, we really don't. That was previously how concussions were managed. There was a ranking system, and there's been several ranking systems over the years. There was a movement in the 90s to kind of start to go away with that, and right now we have a movement to just have a generalized saying that it is a concussion if there's been an injury to the brain.
Okay, and obviously it's caused by an impact, usually to the head. What's the timeline of events that occurs after a suspected concussion occurs?
Sure. Typically what ends up happening is the athlete will be out on the playing field or inside the gymnasium where the injuries occurred, and usually they either remove themselves or they're removed from the activity by their coach or referee. Typically we can also have the athletic trainers notice that something just seems to be a little bit off by that athlete. At that point then usually an athletic trainer is on the sideline and they will give a series of questions and activities for that athlete to do. Obviously, if there's an immediate loss of consciousness, the emergency medical services are notified and those services take over. But typically that doesn't occur on a large scale. So after that activity, the athletic trainer then would guide the family or whoever is there with that athlete into what the next steps need to be.
Now, there's a lot of, I don't want to say pressure, but I think athletes put a lot of pressure on themselves because they work hard during
Sure.
practice. You know, they want to get to that game and they want to play. I mean, who wouldn't want to play? And so I think that there may be some athletes out there, I'm guessing, that may get hit in the head or something like that, and then they don't tell anybody about it. So what could happen if somebody has an injury, they actually do get a concussion, but they don't tell anybody about it?
Sure. The athlete may have some minor symptoms and they don't really recognize it as being a big problem. And so a lot of them do actually return. They may even go home and not notice something until maybe the next day or even several days later. The real problem with that is that if over a period of time we have found that if you are not given the proper management early on, it actually prolongs the amount of time that it takes you to actually recover. Mm-hmm. The other part of that is much more serious, and that's what's called a second impact injury. A second impact injury typically is something that occurs when an athlete has a second injury, obviously, and it can be a very small injury that second time, but what happens is it can cause a great catastrophic injury and cause intracranial pressure in your brain, and that can be really devastating.
So your brain is already injured essentially because
Correct.
from the concussion, and then you jar it further or you injure it
Correct.
further almost.
Exactly.
Yeah.
So as your brain is starting to heal, all of a sudden then you receive a second blow to that area,
Right.
and it can cause much more catastrophic problems.
Absolutely. We got to take a short break. When we come back, we're going to continue talking about concussion management here at Fort Healthcare. Don't go away. Welcome back to Wisconsin Doctors. We are here at Fort Healthcare at Fort Atkinson talking about concussion management, and I'm joined now by Julia Neppel, who is the sports medicine coordinator here. Julia, how are you?
Good, how are you today?
Excellent, excellent. So I want to talk a little bit about cognitive testing. This is something that has been done for a while to determine, I guess, get a baseline and also determine effects of a potential head injury. But you guys do something called cognitive computerized testing. Can you talk to us a little bit about what that is?
We do computerized testing. We do impact testing, which
Sure.
is immediate post-concussion assessment and cognitive testing.
Okay.
What it isn't, it is not a cognitive test as in an IQ test.
Right.
What it does is it helps monitor students or athletes' symptoms, but
Sure.
then it also looks at their cognitive function, as in their memory, their functioning, attention span, their problem solving, and their reaction time and impulse control.
Right. So, kids, this is not going to affect your grades at school if you get a baseline.
Not at all.
Cognitive
It is not.
test. So, okay. How long has cognitive testing been around?
Cognitive testing has been around since about 2006. It started out in the professional levels, obviously with football and hockey and
Sure.
different places like that, and it slowly trickled down to the high school level. Currently, there have been 10 million impact tests done, and that over 7.5 million people have been tested. Each time they do it, it helps revalidate the test.
Is this all high school students or just all people?
All people.
Oh, wow,
So basically,
okay.
the tests that professionals are taking are the same ones that high school and youth are taking as well.
Okay, professional level testing then.
Professional level testing.
Yeah. So you guys have been utilizing cognitive testing, computerized testing for a while. How long have you been utilizing it?
We have been using the impact test since 2010. Sorry.
Okay.
We have had several concussions in the past, and we really needed to learn more. And when this testing came out more publicly in the early 2010s, we decided we needed to be a part of this process to help manage. We have our team of impact-trained athletic trainers. Brian and myself are included in that. And then several primary care providers trained in the reading and the interpretation of the impact tests.
So it sounds to me like even though it's been done on professional athletes for a while, it has only recently, within the last 5-6 years, been available to
Yes.
high school students.
Yes.
Okay, and you guys have picked it up pretty much since the beginning of that. it
We
sounds
have had that since the beginning and really had the opportunity to work with our schools and our programs
Sure.
with that. And we had a grant through Fort Healthcare Foundation that helped us start off the process and got us the money to get it going, and now we're able to implement it with all different levels of athletes.
Yeah, talk to us about some of the different schools and organizations that you guys serve here through Fort Healthcare and working with, concussion programs. Sorry, old band director. Anyway.
We work with the schools that we have contracts with. That includes Fort Atkinson High School,
Sure.
Cambridge High School, Lakeside Lutheran High School, and Palmyra High School. We also work with several of the youth programs that came, youth football in Cambridge and at Lakeside Lutheran, and Fort Atkinson Youth Soccer as well.
Okay, excellent. And so it sounds to me like you go there maybe one day a week or something like that, or you have somebody who comes from Fort Healthcare to be on call if they need to be, or are they scheduled to be there at a particular day throughout the week, or are they just on call?
Our high school athletic trainers are there 3 days or 5 days a week, depending on the school.
Okay.
And they help administer the baseline testing.
Sure.
We also do the baseline testing through the youth programs through the Fort Atkinson High School as well. They let us use their space to administer
Sure.
these tests.
Sure.
And it really starts the coordination of care for the kids. The baseline test is basically getting their fingerprint or what their brain function is
Right.
without having a concussion. So
Right.
then when the concussion comes up, we have something to compare themselves to.
Right.
And it's comparing themselves to themselves, so there's no standardization against
Right.
other people. We can if they don't have a baseline test.
Sure.
But it also is the start of the process. We also work in collaboration with the school nurses, the primary care physicians, and the school administrators, because once a child has a concussion, it impacts every part of their life. And so we need to really coordinate that care and really get
Absolutely.
it going.
Absolutely. Do all athletes just by default need to have a baseline test done? I mean, if somebody's running cross country, which is typically not an high impact sport, do they need to have a test as well?
We typically don't do the lower impact scores or
Sure.
sports, but we do if students would like them and parents
Sure.
request that, we do honor that. We allow whoever wants them to be done at our high school to get done.
Excellent. Well, Julia Neppel, Sports Medicine Coordinator here at Fort Healthcare, thank you so much for the
Thank
information.
you.
We got to take a short break, but we're going to continue talking concussion management here at Fort Healthcare when we come back. Stay with us. Welcome back to Wisconsin Doctors. We are talking concussion management here at Fort Healthcare in Fort Atkinson. And in a moment, we're going to check in with Paul Incha, who's a physical therapist at the Fort Atkinson Therapy and Sports Center. But first, Lori Runty, I want to check in with you real quick because you're a primary care provider, and I'm just curious to know, we just got done talking with Julia, and she talks about, all the things that happen, when a suspected concussion may have occurred. But what are the next steps, and what does a primary care provider do to facilitate or coordinate care for a concussion?
Sure. Typically after the injury, the primary care person is the person that's contacted by the parent usually. And usually then after the initial clinical assessment that we do, we also can look at some of those baseline tests that have been done by the athletic trainers. And then we do what we call initiating a treatment plan. Typically that treatment plan is looking at some of the trajectories or the ways that the child or the person is showing their symptoms. And we found that over the years through the impact group that there are several areas that are very, very consistent. The ones that are usually addressed by the primary care providers include the sleep aspect of problems, the emotionality or the anxiousness that they sometimes have, or in particular the largest problem is usually headaches. But this is very much a multidisciplinary team treatment plan that then gets initiated after that based on those trajectories.
Okay, so Paul, I'm going to jump over to you because you're the physical therapist here at Fort Atkinson Therapy and Sports Center. What does the post-concussion care clinic treatment consist of?
And that goes along with what Lori was saying,
Sure.
that you can treat different things because depending on the concussion, some patients may have some cervical or neck issues related to the traumatic injury.
Sure.
They may also have more vestibular problems with their balance and how their brain coordinates their body with doing things. They also can have issues with the ocular motor, how your eyes see the world and takes that information and allows you to coordinate and do high-level functioning activities. Along with that, there's also some high-level functioning, executive functionings with memory and so on. With that, that would also involve another part of our team who we weren't able to have here today, but some of our speech-language pathologists to address high-level functioning issues of memory and issues that can come along with that aspect of a concussion. As far as the vestibular or balance component goes, within the clinic we'll address various things, whether it's a component of that is coming from the inner ears and how the inner ear works with the brain and how the brain interprets what's going on in the world, and allowing the person, the athlete, to get back to their everyday function. Along with that, there's an ocular motor component of how people see the world, to be able to catch a ball and to be able to see a ball, have hand-eye coordination, to be able to catch and do whatever sport they're wanting to participate in. One final component of that is to address the exercise portion, to progress them with exercise, to be able to return to exercise and activities and not have symptoms of a headache or dizziness or issues with that. And as you progress to that, that then works into some of the further activities that the athletic trainers, that Brian and Julia will do with a young athlete to get back out on the field and go into those aspects once they leave the PT clinic.
Absolutely, and I think you had mentioned, I like how you mentioned cervical and neck problems, because with a head injury oftentimes there are other injuries that come with that, and I think it's important that all of them are addressed.
Yeah,
so.
and that's part of the realm of physical therapy, to look at the neck, are some of these headaches coming from an issue that's related to the concussion, or is it more, just from the trauma or the blow that they took involving their neck, getting that better, and in turn, lo and behold, the headaches and some of the other symptoms begin to clear up and make way to return them to their everyday activities.
Paul Incha, thank you so much for the information today. We got to take another short break. When we come back, we're going to continue to talk about concussion management right here at Fort Health. Stick with us. Welcome back to Wisconsin Doctors. We are continuing to discuss concussion management here at Fort Healthcare. And right now I'm going to talk with Brian Meitner, who's an athletic trainer here at Fort Healthcare. Brian, welcome back, I should say.
Thanks.
Yeah, good to have you back with us on Wisconsin Doctors. So we've talked a little bit about cognitive testing, computerized cognitive testing. After cognitive testing has been passed, the person is cleared that way, and after the primary healthcare provider has cleared them to move on to the next step, what is the next step? What are the return to play or work guidelines for athletes, not just athletes but people, for returning to competition and or work?
Right. Regardless of whether an athlete or someone who's been injured at work has been referred for impact or not, the following steps are taken by an athletic trainer for them to return to play or work. And there's a number of different progression levels. The first one, obviously following a concussion, is no activity with complete rest. But once they've passed that step and done some of the other steps, the first activity-specific test is light aerobic exercise.
Okay.
Meaning less than 70% of their maximum heart rate. So just 15 to 20 minutes of light aerobic exercise, and then they wait for 24 hours and to ensure that no symptoms come back that they were experiencing beforehand. So
15 to 20 minutes of light aerobic exercise, going for a walk could
going
count
for a
that?
walk, going
Sure.
for a bike ride. We
Sure.
try to keep it non-impact so we don't encourage running so much, but maybe a light jog.
Okay.
After they get through 24 hours without any increase in symptoms, we may increase that to 25 to 30 minutes of a little bit higher aerobic exercise. So we'll let them do some jogging, but no heavy sprinting or things like that.
Sure.
So a harder bike ride, a little bit more exertion kind of activity. And then you wait 24 more hours to make sure that no symptoms. Basically, there's 24-hour period between each step to make sure that no symptoms arise. And if any symptoms do arise, then they drop back to the previous step and make sure that that doesn't come back again. So the third step is starting to add in some sport-specific exercises or some work activities if this is a work injury. So a basketball player, we may start to let them do some light running, shooting, but no contact specific drills. Okay. Then we wait 24 hours again, and then the next step is letting them do a little bit more of the practice session, but still no contact.
Right.
And then the step after that is if they followed all those and have passed without any problems, then they can do a full contact practice. So the last step before gameplay is a full contact practice, and if they get through the full contact practice without problems, then they can resume gameplay.
So it's a pretty gradual progression that we're talking about.
Right.
Here.
It's at least 4 to 5 days.
Yeah.
So,
and we just have about a minute left here, but talk to us a little bit about the National Federation of High School Standards, if you would.
the National Federation of High School is what all state athletic organizations are under,
Okay.
Including the WIAA, and they've came out with a standard that any player who exhibits signs, symptoms, or behaviors consistent with a concussion should be immediately removed from a game and shall not return to play until cleared by an appropriate healthcare professional. And appropriate healthcare professionals have been approved or okayed as licensed physicians or licensed athletic trainers.
And we just have just a few seconds left, but I'm curious to know, are these are standards that we're talking about. Is there a law that mandates that these standards are utilized?
Right, yes. There's a state law that was passed in 2012, and now every state has some type of law that any person who engages in an organized athletic activity must sign some kind of a statement that they understand the consequences and or possibilities of concussion. This goes for the participants as well as referees, as well as coaches, as well as parents, especially if they're minor athletes.
Brian Meitner, athletic trainer here at Fort Healthcare. Thanks so much for the information
Thank
today.
you.
I also want to thank the rest of the team, the concussion management team here at Fort Healthcare. It's been a pleasure talking with everybody. Thank you so much.
Thank you.
Thank you.
That's all the time we have for Wisconsin Doctors. From all of us here at Channel 57, we're reminding you to live longer, live better. We'll see you next time.